So when we talk about intent, this is important. There's a difference between having suicidal ideations, which are thoughts and ideas of wanting to unalive yourself, versus having intent to act on those thoughts. There is a difference. And so when I say intent, I mean, is there a plan forming? Is there a desire to act on those suicidal thoughts? All right. A plan would look like this person knows exactly how they will complete the suicide. They know when they're thinking about completing the suicide. I've heard people say, I'm just thinking about doing it on my birthday. Just, this is going to be my last birthday. I'm just going to do it on my birthday. I'm going to utilize a firearm that I have in the house, or I'm going to utilize these pills. I'm just going to take all of these pills that my mental health professional has given me, my psychiatrist has given me. I'm just going to take all of them, etc. So their ideations have turned into intent to actually act on those thoughts. All right. So intent includes a plan and a desire. Now, I do find assessing desire to be slightly more complex because I've spoken to people who have suicidal ideations who they very much intend to complete a suicide, but not because they desire to die. So what they'll tell me is they'll say something to the effect of, I don't actually want to die. I desire to escape the pain of this situation, or to escape this whatever, this discomfort, and so desire is so tricky because you could very well be talking to someone who has suicidal ideations and they intend to act on the thoughts, but they don't actually desire to die. They just desire to escape the pain. And so the conversation then needs to shift towards, okay, if we could help you escape this pain in a different way other than dying, would you consider living? Would you desire to still live? So when we are assessing means, what we're looking for is, does this person have the actual means or the access to the thing to complete the suicide? They may have the idea, they may have the desire, they may want to do it, but do they actually have access to the firearm? Do they have a firearm, or do they have access to someone else's firearm? Do they actually have medication in a large number, like that they can binge and consume? Do they have access to sharp objects if they're going to cut themselves? Do they drive, and can they crash their car? And I'm saying, like, do they have access to the thing that they will use to complete the suicide? Because if they do have access to the means, then that increases their chances. That means that they are more at risk of actually completing the suicide. There are some people who have suicidal ideations and desires, but they are less at risk because they don't have access to it. They couldn't do it even if they wanted to, so they are less at risk. And there are some people who are more at